Welcome to Keeping It Real. I'm David Grossman. Great to be here at the kiosk on alltalktv.com. Terrific to have you for our last show of the year. Yes, that's right, last show of the year. Normally you'll see me here in a jacket. I was going to wear I thought of wearing something different today, Dr. Rad. I thought maybe I was wear a Christmas sweater. And then I realized that I'm Jewish, so I figured, okay, maybe a Hanukkah sweater, but I don't have one. So I wore Toronto Maple Leaf sweater.
Beautiful.
And they haven't seen the ice yet this year, but who knows? Maybe next year. Probably not, but are you a hockey fan? Do you watch sports at all? No? Well, that would make two of us.
I'm a science fan.
Science fan, okay. And speaking of science, let's talk about science. Let's talk about today's show. First of all, I'll tell you what the lineup is, what's going to happen today. We have back with us again this month Dr. Daniel Rad. He's a specialist in alternative medicine, in particular energy medicine. He has helped many people who have run into problems with the conventional medical system, and that's something we're going to talk a little bit about today and the types of people that he's helped. We also have an inspirational, visionary author by the name of Danish Ahmed. He's in the studio today. He's a blind visionary. Have you ever seen a blind visionary before? Neither has he. Anyway, that's coming up soon. And we also have Albert Frank, who's a lawyer. And he was here once before, and we had a small technical problem, so he's back today. We thank him so much for coming back to the studio. We're going to talk again about the crooked real estate vendor, how to watch out for that, because that's something we all need to be very wary of in the real estate industry, especially if we have many real estate agents watching this show. And he's also starting his vlog today, which is very exciting. He's had 30 years in and out of court, so he's got 30 points of experience to talk about. So he'll be likely rolling those out over the coming months in his blog. So that's the plan for today. Let's start off with Dr. Rad. Dr. Rad has helped me personally a few years ago, and the other day I picked up this book, which is what I want to use to open this segment. It's a New York Times bestseller by Kevin Trudeau, Natural Cures They Don't Want You to Know About. Now, who's they? Well, it seems like there's a bit of a conspiracy going on. I mean, this book was written in the United States. He's an American, but I think we probably have, to a large extent, similar system going on there, where these pharmaceutical companies are basically making drugs, making billions of dollars, and these are drugs that, by and large, they may help with the symptoms, the immediate symptoms, but they're not cures, and they cause a lot of other ailments in people. And it's a conspiracy. The government is supporting it. The media, who earns 1/3 of their advertising revenues, get their press releases and read them as though they are news. So these people are going unchallenged. And it's a big, big problem. Dr. Rad, you've had some experience with this?
Sure. The main tool, let's say the main way that human being or even animal or plants, doesn't matter what, let's say, live tissue, can cure himself, herself, and can heal himself or herself is we, me, you. And indeed, we don't need anything to use, even natural one, indeed. But because we don't have such a open mind in how human body works, about real physiology, and about how to maintain this physiology constantly every single day. So that's why human being gets sick. Mm-hmm. And that sickness normally makes the person to run to somebody, even in health store, in herbal store, even may run to farmer telling that, do you have such a herb that can help me with my headache or lower back pain or whatever? Makes me depending. Now we learn to pay and buy. Now we go to doctors, they are really very well informed. They know what they do, and they learn, they pass tests, they are graduate, there is no doubt about it. But in their guideline, that is it. They go by their book, they go by what they learned, that I did when I was doing as an MD and general surgeon. And but later on, I opened my mind to other field, which was called alternative medicine, which was not drug medicine, drugless medicine.
Right, and you've had experience with a number of different types of alternative medicine yourself. Yeah. But before we talk about that, I just wanted to mention this because we're talking about doctors training, and there was a video that I saw online with Pharma Insider, Gwen Olson. So she's one of the many people who used to work for the big drug companies, and now they've become very outspoken people against some of the things that go on. She was saying that her job, before she was like even 30 years old, she was making over $100,000 a year, going around calling on all different kinds of doctors, surgeons, specialists of all different kinds, and basically pushing drugs, learning how to minimize some of the dangers, like just in terms of talk, like the dangers were there, but how to get them to look away from all these things. Now,
I send you 3 email addresses. That one of them was from Eli Lilly, and who talks about who was working for a pharmaceutical company, going to doctors and advise them, educate them, inform them about new medicine or ex-medicine. What
Dr. John Rangan Virapin, ex Eli Lilly salesman, says the pharmaceutical companies are criminal.
Yeah. Now, I'm not telling that, but he's telling that. He has more experience than me in pharmaceutical field. But I know that as a ex-medical doctor, and I know each drug. I told last time I was talking to Janet, when we say pharmacy, we are talking about drug, we are talking about toxin. Pharmakia means toxin, and pharmacology means toxicology. We are learning about what toxin may help and may damage. For sure, our body is not compatible with any chemical. Regardless, our body works on bioenergy and biochemistry, which are both helping each other to keep a human being alive, healthy. Now, there is no doubt that we are used to, David, you know what? When somebody feels little pain, says that, oh, let's go take X-ray to see why I have lower back pain. I say, why you need to do X-ray? Useless. How happened? You have to think about it. Yeah, if you got involved car accident and a slip and fall or work injury, harsh, acute, bad injury, then it's better to do so to see if it's broken, fracture, whatever, take care of whatever happened. But if not, you don't need to. Just do exercise, do massage, and you will be fine.
Right.
And maximum take some painkiller, kind of aspirin, acetaminophen, very light, and then allow yourself to get healed.
Right. Well, now I know that you've had experience in many different alternative medicines, including acupuncture and others.
Traditional Chinese medicine.
Right. And Ayurvedic medicine.
Ayurvedic
What
medicine,
is that Indian medicine, Ayurveda?
Yeah. Ayurveda, homeopathic medicine. Then energy medicine is my, let's say, favorite one, and I'm good informed about it.
Right.
So
what are some of the types of cases that you handle?
I deal with. I mean, I help them to get cured and healed, not just cured, or any ongoing illness, sickness, symptom, syndrome that the patient didn't get result good enough from allopathic medicine.
Allopathic? What is okay, so from traditional Western medicine. So most of the people who come to you, they've gone to the regular system
and they didn't get well, and plus some of them they got more other health issues, and or the same condition got worse, and they don't know what to do, and they are sick for years and years, minimum 2 years, 3 years, 5 years. I have patients, they are going through disability, mentally, physically, emotionally, organically for a long time, and they get worse. So they come to me. Normally, what I do based on energy medicine, I have a specific approach. Start to reprogram their computer. In other words, start to make them be in connection, in communication with themselves, have access to their own database, or which is unconscious mind.
So it has a lot to do with what's in the mind, how people think?
What is in the mind. We don't get sick, David, if we don't plan for. We don't get sick if we are not afraid of getting sick or be worried about that. Now, negative emotional issues, traumas, they are the main reason of human being illness and sickness. So when such a thing happens, there is no good enough communication between in the same person, so that miscommunication will misconduct the program and make the person get sick. Depends on what emotions, what trauma, what type is going on, will affect the same organ which is responsible of hosting that energy.
So you help people get in touch with some of those issues.
What I do, reprogram them, delete wrong programs, and install a right program. In other words, the main reason of sickness, which is wrong resonance, wrong, let's say, energy, will followed by installing right program. And we know that, say, person says, if you think about at the vibration of parasite, you will get parasite. If you resonate, your body resonates at the level of some bacteria's resonances, you will get the same bacteria or virus or fungus. So we have to resonate the same way to get the same, according to.
It sounds complicated for a layperson, but I know you've helped many people.
Let me specifically say what I do. I do help for people who are sick and tired of being sick. In other words, if a person still can afford the luxury of being sick and follow every month, every 3 months and whatever, go check it out to see how blood pressure is, how cholesterol is high or down, how such a medication helped or not, and how's diabetes, his blood sugar is going up and down, what to do and what not to do. If a person is going on through chronic severe conditions, gastritis, ulcerative colitis, any digestive system, Crohn's disease, and IBS, IBDs, irritable bowel disease, or osteoporosis, osteopenia, anything you name which is going on, and patient is involved, and 24 hours a day for 12 months, every year, year by year, is worried about what will happen to my kidneys by having such a, let's say, diabetes I have. And we know that sugar high, finally, if it's not taken care of, that is not taken care of properly by patient, will end with kidney failure or some other complications.
Is there a connection between the type of disease and the emotional issue, let's say?
For sure. There are negative emotional issues. They are compatible with the same, accordingly, the same disease. In other words, if a person is fearful, angry, worried, for sure will have digestive system problem. When we say digestive system problem, starting from mouth to the rectum, and each part of digestive system will be involved. Other organs like liver, gallbladder, pancreas, they are playing different role in digestive system. They are staying out of digestive system, but they are connected to by producing some biochemically active substances, enzymes, or let's say solutions or hormones, whatever. There is a very close communication between organ to organ and system to system. So we cannot say that the stomach works for itself and kidney works for it. All of them, they are working for each other in order to keep themselves healthy.
So it's a very wide range of issues that you can help people with.
Wide issues, chronic ones, which are not healed, which are not cured for a long time. In other words, we say, I was telling last time, if some symptom stays in the body, no matter what it's called, more than 6 weeks, that means this is telling that be careful, this will go on, and you are jeopardizing your health. specifically generally in long term. So we have to be careful with that, and no matter what is a problem, sickness must be gone in 6 weeks.
So
more than 6 weeks will be problem.
So is it better that people see you right away? Because it sounds like most of the people who come to you have maybe battled for months or years with Western medicine.
I would say people who are suffering from ongoing diseases, chronic disease, illness for a long time, and they don't see any result. They have to take medication almost for whole life, told by doctors told by Eli Lilly or the other ones telling that this is the medication, your patient must take this one. Funny thing popped in my mind. I had a patient, they come from even from US to me, from States. I had a patient came for some reason, and when normally I ask question and past medical, past emotional history, he said that I'm taking medication to lower the blood sugar, lower blood pressure, and lower cholesterol. I said, do you have them? He said, no, last test showed that none of them is high. I said, why you take that? This is new method is they created for last few years, for last 5 years I know, saying that, okay, you are over 50, you should better take this medication to prevent diabetes, to prevent high blood pressure, to prevent high cholesterol. This is surprising, even they don't have it, why they have to get it to prevent.
Yeah.
Prevention can be done different way, telling that do exercise, pay attention to your mind, pay attention to your emotions, keep them healthy, keep them clear, and pay attention to what you eat and digestion, you won't get them. Why we have to take such a chemicals in order to prevent that we don't have it, we may get it.
Okay, so Dr. Rad, your office is in Toronto in the Bloor Street, Bloor and Bathurst area. The phone number is 416-535-8034. If you fit into this description and you have not been helped by traditional Western medicine and you need help, call Dr. Rad. He's helped probably thousands of people over the years.
I'm doing this for the last 22 years in Toronto. 22
years. So he's your guy. Be sure to give him a call. The website is www.curesallergy.com. Dr. Rad, thank you very much for being here today.
And
we will thank you very much, and happy holidays to you. And we will see you next month.
Great.
Hang in there. We're going to be back with Danish Ahmed after this short break.